I see a lot of patients with labral pathology, okay? And so what to understand about that is the labrum is basically a structure made of cartilage that kind of acts like the suction cup. So the human shoulder is a big ball and a little socket, kind of like a golf ball on a golf tee, okay? But it gives you amazing range of motion. Around the socket, there's a thick rim of cartilage called the labrum, and that's kind of your suction cup, okay? That labrum can get torn in a few different situations. Certainly one is traumatic, dislocation, sports injury, and that can tear that labrum, okay? The other group of patients I see is kind of chronic wear and tear. And over time, it can develop tears in it, kind of like crab meat almost, and that can affect the suction in the shoulder. And that eventually gives you pain, sometimes loss of motion, a lot of times painful noise, clunking and popping, okay? And so in patients where they're having these symptoms and they're not getting better, they may have tried some activity modification, anti-inflammatories, maybe even some home exercises, but they're still having loss of motion, painful noise, and weakness. It's important to get that evaluated. And the first thing I'll do is x-rays to evaluate bony structure, physical exam, and then if I suspect a labral tear, I will typically get an MRI, and that will help me identify where it is, how big it is, and then a specific treatment plan, okay? Sometimes if you catch them early and it's a small tear, you can potentially treat them non-surgically. Cortisone injections, anti-inflammatories, a specific physical therapy program can be very helpful and typically with very good outcomes, okay? If someone has a labral tear that is not responding to conservative management, or if it's a big tear that's causing a lot of pain, that is usually arthroscopic surgery, where I can fix that 100%. Put a camera in, either clean or repair, basically repairing the suction cup and restoring the normal suction. And that can be fixed 100%. Okay, and so I understand fear with patients and surgery, but this is one of those things where we can really, really restore normal function and full range of motion and full strength. I've gotten patients back to college and pro level athletics. So even our weekend warriors, we can typically help. We typically use absorbable little anchors, and we can anchor that cartilage back to the socket. And then once your body heals it, it's yours again and normal. So there's no metal, there's no implants that remain. It's a great technique now over the years that we've developed. Recovery and return to activities after this kind of a diagnosis certainly depends on severity. It can vary anywhere from if it's a minor tear that requires just a cleanup, okay, and not necessarily a repair, that can be returned to athletics in 4 to 6 weeks sometimes, okay, even for a high-level athlete. If I have to physically repair that cartilage, or even worse, reconstruct it, that can be a 4 to 6 month process to get full range of motion and full strength back. And then even beyond that, if someone specifically is a pitcher, and I take care of a lot of throwing athletes, that's even a few months after that, because they'll get their full range of motion back, but the act of pitching takes a few months to really get back.